We are learning so much more about COVID myocarditis and the effects of COVID on cardiac function post-infection. And we're realizing that while, yes, clearly cardiac function is affected in our more critically ill patients, we're also finding that athletes who are asymptomatic or minimally symptomatic are having myocardial dysfunction as well.
I'm sure a lot of the primary care physicians around the area and pediatricians are seeing a lot of patients returning from a COVID infection, and I'm sure it can be overwhelming determining who may be that needle in the haystack that really is going to have some cardiac issues. We've created a algorithm to help support your decision making, and what you should know is the vast majority of patients, especially the recreational athletes, do not require additional testing. However, for those patients who maybe had more significant symptoms at the time of their COVID infection or are complaining of issues currently, a further evaluation and treatment may be necessary. And you can always reach out to cardiology at Children's in order to get that information.
We have a tool on our website, childrensomaha.org, in the provider section to help you decide, do your patients need to just be evaluated for symptoms, maybe have their heart listened to make sure that it's regular, or do they need a basic cardiology workup that can even be done in your office, potentially? Or is this somebody that needs to either see me or my partner in sports medicine or at cardiology to have the full echo, cardiac MRI, kitchen sink thrown at them?
So I think for primary care physicians and pediatricians who are seeing patients complaining of symptoms, really the symptoms that need further evaluation are going to be patients who have chest pain with activity, patients who are experiencing palpitations, tachycardia, pre-syncope or syncope. Those are all red flags that further evaluation will be needed. One of the more difficult symptoms to evaluate is shortness of breath as our athletes are getting back into activity. Shortness of breath can unfortunately be multifactorial, but the majority of time it's not cardiac in nature, but there can be complications with the pulmonary system, the respiratory system, and certainly deconditioning for a lot of highly tuned athletes is a real problem. Sitting out for 10 to 14 days is oftentimes difficult for the highly trained athlete, and that certainly complicates their return to play.
We just want to make sure that our athletes are safe as they go back to sport. And as we learn more about COVID and its effects on the heart, we're going to be able to give you much easier, more defined terms. But stay tuned to the website, and we will be updating that as frequently as we can.